Welcome to MD-VOD, your health live and on demand. I'm Dr. John Kennedy, and today we're taking a look at multiple sclerosis, a condition that affects approximately 2.5 million people worldwide and 400,000 Americans. It's the second most frequent cause of neurological disability beginning in early to mid-adulthood. MS is 2 to 3 times as common in women, with an increased risk of developing the disease from the teen years to age 50. No one is sure what causes multiple sclerosis, and while treatment can relieve the worsening of symptoms, there is unfortunately no cure yet. Chances are you or someone you love has been affected by this condition, so join us as we simplify what you need to know to begin to understand multiple sclerosis. As we do with every illness, we'll help explain in simple terms what multiple sclerosis is, who's at risk, what the dangers are, and the most common symptoms. I'll be joined by expert neurologist Dr. Robert Giombetti to help discuss how we diagnose this condition and what he feels are effective treatments and therapies. We'll also address the symptoms and look at whether insurance covers costs. So join us as we simplify what you need to know about MS here on MD-VOD, your health live and on demand. Welcome back to MD-VOD. Understanding any disease involves really knowing the anatomy. Today we're talking about multiple sclerosis, a disease that involves our nervous system. Our nervous system is made up of nerve cells called neurons. Each neuron has a body and a middle layer known as an axon, which carry nerve impulses throughout our body. These neurons allow us to feel sensations like pain and temperature, to sense vibrations, and to control our body's motor functions like walking and talking. Multiple sclerosis is a disease that affects the outer protective layer of the neuron, known as the myelin sheath. The myelin is like the plastic or rubber coating that covers an electrical cord and insulates and protects the electrical wiring. Stay tuned and learn more about multiple sclerosis here on MD-VOD. We're back on MD-VOD, your health live and on demand, talking about multiple sclerosis. MS is a disease affecting the central nervous system, where the nerves of the brain and spinal cord are attacked, affecting muscle movements, including walking and talking. It's an autoimmune disease in which the body mistakenly attacks itself, destroying normal and healthy tissue. MS gets its name from the buildup of plaque or scar tissue known as sclerosis, which occurs in the brain and spinal cord, where the protective and insulating myelin that covers the nerves is destroyed. Without the myelin, electrical signals in the body are disrupted, and then the brain becomes unable to send or receive messages. Symptoms of multiple sclerosis vary from person to person and can change over time. The most common early symptoms include muscle weakness, like difficulty walking and feeling heavy feet, tingling in your hands and toes, and decreased coordination with clumsy walking, and the most common symptom, which is double vision. As the disease progresses, symptoms may include muscle stiffness or spasticity, pain, difficulty controlling urination, or cognitive difficulty. MS is a lifelong disease, but its effect on the individual varies greatly. Approximately 85% of those with MS experience a relapsing or remitting pattern of disease. Attacks of symptoms called exacerbations, followed by periods of stability or remissions that can last months or even years. As the disease progresses, however, periods of remission often become less frequent. Adhering to a treatment plan, eating well, exercising, and reducing stress can all help people live more comfortably with the disease. A diagnosis of multiple sclerosis is made by the history of symptoms and a good neurologic exam. When we come back, we'll be joined by expert neurologist Dr. Robert Giombetti to look at how we diagnose and treat this disease, as well as some tips about insurance providers and costs. We're back on MD-VOD, where today we're talking about multiple sclerosis, and we're here with board-certified neurologist, Dr. Robert Giombetti. Robert, thanks for joining us.
Thanks for having me, John.
So, what is MS, or multiple sclerosis?
Multiple sclerosis is a chronic, often debilitating, demyelinating disease of the central nervous system. It involves the brain, the spinal cord, and the optic nerves commonly. If you think about the brain in the most simplistic way, it's really a system of nerve cells or neurons that are connected by wires, if you will. Those wires are the axons, and they are insulated like most electrical wires are. Well, it's that insulation, the myelin sheath that covers those wires that gets affected primarily with MS. Traditionally, that has been a disease. It's one of the demyelinating diseases. But as we'll talk about a little bit later, it's also a disease of the wires itself, or the axons.
Okay. And do we have any idea what causes it?
We have a lot of theories. There's a lot of conjecture. We know that it's an autoimmune disorder. We know that the T cells are inherently involved with mediating the disease. We also know that there are environmental factors to MS. We know that the highest incidence of MS in the world occurs in temperate climates, such as the eastern seaboard of the United States, the United Kingdom, Eastern Europe. But it occurs everywhere.
So that's a great point. Multiple sclerosis is a disease, a demyelinating disease, which the immune system, we think, attacks the sheath, or the insulation of the axon or the nerve, and that is what leads to the symptoms that we'll talk about. And Dr. Giombetti, what are some of the more common symptoms that we see when someone comes to your office with multiple sclerosis?
Well, John, really in multiple sclerosis, there can be any symptom that would occur by a dysfunction of any part of the brain, essentially. Like, the most common symptoms that we see, though, are blurred vision, particularly with optic neuritis presentations. Numbness is very common, and numbness in any part of the body. Trouble with cognition is very common. Dizziness, vertigo, double vision, another very common symptom with MS. You can have frank weakness, inability to move an extremity. Gait disturbance is very common as well. Trouble walking, stumbling, walking like you're drunk. These are all very, very common presenting symptoms of MS. And as you go through the course of the disease, symptoms tend to add up, so that it can become very complicated. So you don't have one or two symptoms, but you'll have 3 or 4 at the same time.
So it sounds like it's a very general sort of group of symptoms. It's not any one thing that kind of gives you the clue. Is there a typical age that people present when they have MS? MS can present as young as early adolescence, or even younger. We do have pediatric patients with MS. The most common age of onset is between 20 and 50 years of age, although I've diagnosed MS in 65, 70-year-olds in the past. Wow. Dr. Giombetti, how do you make the diagnosis once you have a suspicion that it is multiple sclerosis?
Well, as you said, John, it initially really takes a comprehensive neurological history and neurological examination. Many of the MS syndromes, if you will, are very stereotyped. We see the same presentations over and over again. After you do a complete history and physical, then the most important tool in the diagnosis is MRI scanning. We have very powerful MRI scans now that are very sensitive to pick up MRI lesions. The diagnosis is most often made then by a combination of the clinical symptoms, of the neurological examination, and the findings on MRI scanning. And we even have criteria as far as number of lesions on an MRI scan to make the diagnosis. In addition to that, we use lumbar puncture and CSF analysis as an adjunctive aid to diagnosis oftentimes.
So the number of lesions that Dr. Giombetti is referring to means the number of abnormal spots that you would see on an MRI, which is a very powerful scan that shows very accurate definition of the brain. And these particular spots that are consistent with the diagnosis of multiple sclerosis. Dr. Giombetti, so once you've made the diagnosis and you know that's what this patient has, what types of treatments are there available to help treat the symptoms?
So first we had beta-serone, then we had Avonex. Again, Avonex was a once-a-week medication.
Is that an injection or oral medication?
They were both injections. They were both, well, beta-serone is a subcutaneous injection. Avonex is an intramuscular injection. At that time, we also became more aggressive in diagnosing MS, in that when a patient would come to us with those symptoms that we talked about, with numbness or with blurred vision, we wouldn't wait, as we would traditionally, till the second event to make the clinical diagnosis. We would make the diagnosis and then we would start to treat the patient. And that really benefited vast numbers of patients as far as the clinical course of their disease. We know that with all of the current medications, rather with most of the medications, the standard is that they reduce relapses by 30%, but they also reduce disability by 30%.
Wow.
And the major disability in MS is going from walking to wheelchair. Wow. So we're very aggressive now in trying to prevent that from occurring. We have a variety of other treatments that are available. There's another interferon, similar to beta-serone and Avonex, Rebif, that's 3 times a week, another subcutaneous injection. We have Copaxone available. That's an everyday subcutaneous injection that has a little bit of a different mechanism of action. And these are exciting times in MS with some of the newer treatments that we have as well.
And I was just going to ask you that. Is there anything new, other than the drugs you've already mentioned, that's sort of coming down the pike to treat this disease?
Well, we have also Tysabri available, and the Tysabri story is another very interesting story in neurology, in that it was released initially in 2004. Much of the MS community at that time thought this was as close a cure as we can possibly hope for. It's a monoclonal antibody. It's a very involved treatment in that it's an intravenous injection once a month, but a very effective treatment. 70% reduction in relapses.
So is there anything that you could tell our viewers that might decrease the cost of MS?
I urge all my patients to be compliant with their medications. You know, they need to do the injections, they need to take their medications, they need to do it religiously. Other than that, they really need to manage their comorbid illnesses. If they're hypertensive, they need to treat that. If they're diabetic, they need to treat it. They need to really change their lifestyle. They need to exercise. They need to be healthy. They need to eat well. Those things are very important. I think the patients that have a healthy lifestyle are the ones that do much better in MS.
Well, it's an incredible take-home point. You know, MS can be a debilitating disease. Dr. Giombetti very eloquently pointed out how treating it, the treatments that are available now, decrease relapses, decrease the chance of getting another symptomatic episode. And that alone, by getting diagnosed by a neurologist and by taking your medications, can lower cost by not hospitalizing someone or potentially requiring a wheelchair. That was incredible information. Thank you so much for such a thorough discussion on a very important disease. Thank you, Dr. Giombetti. Up next on our Apple a Day, we'll hear from a special guest living with MS, Mr. Montel Williams, that'll tell us how to prevent the symptoms and complications of MS. Welcome back to MD-VOD, where we're talking about multiple sclerosis. And to better understand any disease, it's helpful to hear what it's actually like to live with it. Today we're joined by special guest, Mr. Montel Williams.
Thanks so much for having me.
Thank you very much.
Absolutely.
Thank you very, very much for joining us. You know, Montel, you've accomplished more than most people in their lifetime. You're an author, you're an amazing television host. You do great things about wellness today that I love, and you were in the military and did incredible things.
Thank you.
What do you attribute all of your healthful success to?
No ifs, ands, or buts. It's absolutely changing and living by what I've been preaching rather than just preaching it. You know, people have heard me for the last 10 years of my life talking about the fact of how important exercise, diet, making sure that if you're on medication, you take your medication, you take it and comply the way the doctor wrote it. You've heard me talk about that, and I have tried to probably up until about 4 years ago, did this really 65%, 70%. You know, you try to make it happen, and a couple days, a week, you make it work, and then the next couple days, well, then a couple days you make it work. It wasn't until I actually flipped the switch and said, no, I mean, I got to stop with the goofing around. I got to really pay attention to this, because unless I do so, any thought of impacting the speed by which this illness is ravaging my body, I could throw out the window. If I pay attention and recognize that there are things that we can do. I can't cure MS, but there are things that I can do to impact how I feel every day. You got to get busy with it. And so the second I realized that I was not going to, one, live down to other people's expectations. I say live down to them because they're the ones who were telling me that just because I have MS, I'm going to degrade this way or that way. Number two, when I also realized that I can live up to my own, which means, yeah, I can't go nuts, but if I want to push myself a little bit, let's push a little bit in the direction of living as healthy as I can. That's what's making a difference.
One other thing I'll ask you is, are there any things that you should avoid in terms of dietary supplements or anything you're eating in your diet, and what exercises might we avoid if we have MS?
We want to make sure that you don't, there's this threshold with MS because of our body temperatures, and especially if you have any kind of temperature aversions or issues with regulating your body temperature. You know, I had for quite a long period of time. I couldn't go out, and a lot of heat above 90 degrees can really start to weaken me very quickly. So you have to pay attention to how rapidly your body heats up. So I would say, can you be a marathoner? Yes. Can you be a triathlete? Yes. But as you're training, if you start to notice that, let's say, you know, you push yourself to a point where you start not just getting tingling, but you're getting numbness and there's something going wrong, I'd back off to your doctor. You know, don't push yourself to that point of failure, because, you know, what I'm going to show people over the course of the next year, and I'm really on a mission, Doc, I'm telling you, I want people to understand that, again, 10 years ago, a doctor told me I would be in a wheelchair in 4 years. Ha ha. Okay, so he was wrong.
No wheels.
No wheels. Two, I told myself 2 years ago, you can't. Guess what? I can now. And I'm going to continue to until I don't want to, not until I can't. So what I'm really trying to do right now is to make sure that this journey between now and the time that I leave this place will be on my terms. And yeah, I have MS. It's going to continue to just come at me, and I'm going to continue to do everything I can. I'm going to put up a good fight. And like I said, if at the end of the day this weakens me to a point where I need assistance, I'll still exercise through my assistance. If this gets to a point where, you know, whatever it is, I will then have had an unbelievably good life because I lived every day to the fullest and tried to make sure I took advantage of all the knowledge I have to live as well as I can.
To live the most productive life possible with MS and to get the best care, be sure to build a good relationship with your entire healthcare team, your neurologist, nurses, therapists, and medical assistants. Communication is key. Prepare for appointments by keeping an MS diary, writing down symptoms, what works to relieve them, and what doesn't. Make note of questions before visiting your healthcare professionals. It helps to note specific topics so that you can communicate clearly and not forget. Eating well, exercising, and relieving stress are all important elements for your well-being, especially when living with MS. Set realistic expectations and try to accomplish them. Make sure to be aware of your emotional health too. This disease can really take its toll. Support groups can be very helpful, so be sure to stay on top of the latest news about multiple sclerosis research at cdc.gov, because the more knowledgeable you are, the healthier you will be. Thank you for joining us. I hope you found this information about multiple sclerosis helpful. I'm Dr. John Kennedy, and you're watching MD-VOD, your health live and on demand here on emPOWERme.tv. Don't forget to like us on Facebook, follow us on Twitter, and share us with your friends and family. And episodes you might have missed are available now on demand at emPOWERme.tv's website and YouTube channel. And be sure to leave us comments and questions so we can better help you. See you next time on MD-VOD.